Welcome to this Medical Receptionist interview preparation guide. In the next few minutes, we will cover the 20 questions employers ask most often, along with strong answer examples you can adapt to your own experience. Whether you are applying to a clinic, hospital, outpatient center, or medical office, these answers will help you sound calm, capable, and prepared. Before we begin, remember what employers are really assessing. A medical receptionist is often the first impression patients receive. Interviewers want evidence of warm communication, smart scheduling decisions, accurate record handling, strong confidentiality, and teamwork. As you listen, think of one real example from your own work, study, or volunteer experience that proves each strength. Question 1. Tell me about yourself. Keep your answer focused on the job, not your whole life story. Highlight organization, communication, and comfort in busy settings. A strong answer could be, I am organized, friendly, and comfortable helping people in busy environments. I enjoy work where accuracy and communication matter, and I would focus on greeting patients professionally, keeping schedules moving, protecting information, and supporting the clinical team. Question 2. Why do you want to work as a medical receptionist? Show that you understand the human side of the job. You might say, I want a role where I can combine customer service with healthcare support. Patients may arrive worried or uncomfortable, and a calm, helpful front desk can make a real difference. I also value structured work that requires accuracy, follow-through, and teamwork. Question 3. What do you understand about this role? Avoid saying it is only answering phones or checking patients in. Explain the full responsibility. A polished answer is, the role includes welcoming patients, verifying information, scheduling appointments, updating records, routing messages, handling paperwork, and communicating with clinical staff. The goal is to keep the office organized while ensuring every patient is treated respectfully. Question 4. How would you handle a very busy front desk? The key is prioritization without losing professionalism. Say, I would stay calm, help patients who are physically present, answer calls professionally, and communicate realistic wait times. I would use the scheduling system carefully, avoid rushing through patient details, and ask for team support if several urgent tasks happen at the same time. Question 5. How do you greet a nervous or upset patient? Your answer should demonstrate empathy, clear communication, and appropriate boundaries. A strong response is, I would use a calm tone, listen without interrupting, and acknowledge the patient's concern. Then I would explain the next step clearly, such as checking them in or contacting the nurse. My goal is to make the patient feel heard while keeping the process moving. Question 6. How do you manage phone calls while patients are waiting? Employers want balance, not a choice between one or the other. You could say, I would answer calls promptly and professionally, but I would not ignore patients at the desk. For a non-urgent call, I would politely take a message or place the caller on a brief hold. I would keep both interactions respectful and organized. Question 7. How would you protect patient privacy? This is a critical question. Mention verification, secure records, and never guessing. A strong answer is, I would verify identity before discussing any information, avoid speaking private details loudly, keep paperwork secure, and lock screens whenever I step away. If I were unsure whether information could be shared, I would check with a supervisor instead of guessing. Question 8. What would you do if a patient is angry about a long wait? Stay calm, do not blame the clinical team, and offer realistic options. For example, I would remain professional, apologize for the inconvenience, and check the appointment status. I would give a realistic update without blaming anyone. If the delay were significant, I would offer approved options, such as rescheduling or speaking with the appropriate staff member. Question 9. How do you verify patient information? This answer should show that you understand the consequences of small mistakes. Say, I would confirm the patient's full name, date of birth, contact information, insurance details, and appointment information according to clinic procedure. I would update the record carefully and double-check spelling, numbers, and appointment details, because even small errors can cause billing issues or delays in care. Question 10. What experience do you have with scheduling or electronic health record systems? It is fine if you have not used the exact software. Focus on learning agility and accuracy. You might say, I learn new systems quickly and follow step-by-step procedures carefully. During training, I take notes, practice common tasks, and ask questions early so I can schedule accurately and avoid duplicate or incorrect appointments. Question 11. How would you handle a late patient? Lead with policy and respect. A clear answer is, I would follow office policy first. I would confirm the appointment time, check how late the patient is, and ask the provider or clinical team whether the patient can still be seen. Then I would explain the available options respectfully, such as waiting, rescheduling, or changing the visit type. Question 12. What if a patient asks a medical question at the front desk? This is a boundary question. The safest answer is, I would not give medical advice. I would listen to the question, document or route the message correctly, and connect the patient with the nurse, physician, or clinical team. It is important to stay within my role and make sure the patient receives accurate guidance. Question 13. How do you handle insurance or billing questions you cannot answer? The interviewer wants honesty and good follow-up. Say, I would be honest and avoid guessing. I would review the information available to me, then refer the patient to billing, insurance verification, or a supervisor when needed. I would also document the question clearly so the right person can follow up and the patient is not left without an answer. Question 14. Describe a time you made a mistake. What did you do? Choose a genuine but low-risk example and show accountability. You could say, when I notice a mistake, I do not hide it. I report it quickly, correct what I can within policy, and learn from it. For instance, if I entered an appointment time incorrectly, I would notify the team, contact the patient if needed, and improve my checking process to prevent a repeat. Question 15. How do you prioritize tasks? Show that you understand patient impact and time sensitivity. A strong answer is, I prioritize by urgency, patient impact, and deadlines. A patient at the desk, an urgent provider message, or a time-sensitive appointment issue would come before routine paperwork. I also keep an organized task list so smaller duties are not forgotten during busy periods. Question 16. How would you handle confidential paperwork left at the desk? Your answer should be direct. I would secure it immediately, place it in the correct location, and notify the appropriate person if necessary. I would never leave patient documents visible to other patients or visitors. Protecting confidentiality is not an occasional task. It is part of everyday front desk professionalism. Question 17. What would you do if a doctor is running behind schedule? The best response combines communication and realism. Say, I would speak calmly with patients, give realistic updates when allowed, and coordinate with the clinical team. I would not make promises I cannot control. If the delay became lengthy, I would offer approved options, such as rescheduling or waiting, while keeping the patient informed. Question 18. How do you work with nurses, providers, and other staff? This is your teamwork question. A good answer is, I see the front desk as part of the full patient flow. I would share accurate messages, ask clarifying questions when necessary, and avoid interrupting clinical staff unless something is urgent. Good teamwork means clear communication, respect, and reliability. Question 19. What are your strengths for this position? Connect your strengths directly to the role. For example, my strengths are organization, patience, attention to detail, and professional communication. I can stay calm while handling busy phones and waiting patients, without losing accuracy. I also learn procedures quickly, accept feedback well, and take responsibility for providing a dependable patient experience. Question 20. Why should we hire you? This is your final value statement, so sound confident but not exaggerated. You might say, you should hire me because I bring reliability, a patient-centered attitude, and strong attention to detail. I understand that the front desk affects both patient trust and clinic flow. I would work hard to be professional, accurate, and helpful every day. At the end of the interview, ask thoughtful questions of your own. You can ask about training for new medical receptionists, the clinic's scheduling or electronic health record system, busy times of day, how urgent messages reach clinical staff, and the qualities that help someone succeed in the office. These questions show maturity, preparation, and a genuine interest in doing the job well. Before the interview, prepare 2 or 3 real examples that show your skills. Emphasize privacy, accuracy, patience, reliability, and professional communication. Never guess about medical, billing, or policy questions. Route them to the right person. Bring your availability, references, and training details. Most importantly, stay calm, be specific, and show that patients can trust you. Good luck with your interview.